The topic is cystine crystal in bone marrow. The definition is the cystinosis is a rare autosomal lysosomal storage disorder caused by a defect in cystine transport. It is caused by the defect in lysosomal storage of the amino acid cystine, typically owing to a mutation in cystinosin, a lysosomal membrane protein. Free cystine accumulates in lysosomes in cells, including cells in kidneys, livers, eyes, and brain.
The Cystinosis Foundation educates families and patients and medical professionals about cystinosis. It is an ongoing mission that we have extended internationally. On a biannual basis, we host educational conferences for medical professionals and families. This summer, July 24th through 26th, the Cystinosis Foundation is collaborating with the Cystinosis Foundation of the United Kingdom to host the 8th International Congress in Manchester in the United Kingdom. The two additional functions of our organization is supporting the Cure Cystinosis International Registry, which was established in 2010. You can visit the website at cystinosisregistry.org. We encourage every patient to register. This helps medical professionals understand more about this ultra-rare disease. An important aspect of our mission is mentoring the establishment of support groups around the world. Removing the severe, lonely aspect of coping with an ultra-rare disease is very important, and establishing support groups in different nations has helped remove those feelings of isolation.
Application in medicines. The diagnostic is made by observing cystine crystal or by measuring the cystine content of leukocytes. Although cystine crystals that are observed in the cornea of slit lamp examination or in the bone marrow are diagnostic of cystinosis. They may be absent in patients younger than 8 years of age.
Cystinosis, a genetic disease characterized by the widespread deposition of amino acid cystine in cells due to a defect in cystine transport. Cystine normally forms after protein degradation and is transported from structures called lysosomes into the cytoplasm. In cystinosis, cystine accumulates in the lysosomes and eventually forms crystals throughout the body. Cystinosis is therefore the lysosomal storage disease. The disease is inherited in an autosomal recessive manner. The gene that is mutated in the disease is symbolized CD and has been mapped to chromosome 17 to region 17p13.1. CD encodes the protein cystinosin, which transports cystine. The initial symptoms of cystinosis are renal and appear between 6 and 12 months of age. The accumulation of cystine results in what is called the renal Fanconi syndrome, the failure of the tubules in the kidney to reabsorb small molecules, causing increased urinary loss of electrolytes sodium, potassium, bicarbonate minerals, glucose, amino acids, and water. These losses result in dehydration, excessive urination, polydipsia, excessive intake of fluid, dehydration from the excess urination, hypophosphatemia criticus due to loss of phosphate in the urine, and growth retardation due to the renal disease. Photophobia, excess sensitivity of the eye to light, occurs between the childhood and adolescence due to accumulation of cystine crystals in the cornea. Cystine storage in the thyroid leads to hypothyroidism, usually around age 10. Intelligence remains normal. Treatment of the renal Fanconi syndrome is by replacing the renal losses and supplementing with citrate to alkalinize the blood. Phosphate replacement prevents and heals rickets. Vitamin D helps the intestinal absorption of phosphate. The outlook with this disease changed for the better with cystine depletion therapy using cysteamine cystatin, which depletes cystine.
Pros and cons. One of the biggest advances in treatment with cystine are drugs that have recently been approved for the use by FDA. It is orally used of telomina deplete cystinosis cystine. pass through the lysosomal membranes interacting with cystine and cystine to form a mixture of dissolved cysteamine. The most common side effects are nausea or cystine vomiting caused by powdery, by smell and taste, increasing gastric acidity and delay in pain. Also report anorexia, abdominal pain, portal importation, and gastric varices. In prolonging therapy, they are caused by liver disorder venous.
We are in Charlotte, North Carolina. The reason that we are here is to bring together folks with stenosis. The point of this event was to get patients together and have some real honest conversations. I really want us as adults to be able to help our future generations.
This weekend's event was described as future by design. This is a live event. No influencers, no enablers, just the individuals that have it.
The adult stenosis now is really the first group of adults with stenosis that are healthy. I think a lot of us were told that we would die at a very young age. We're not anymore. We're here, and we are healthy. And we want to see future generations get even farther. Me personally, I feel like I've kind of got extra 20 some odd years, and I would love to see future generations not even think about that. Like not think about when they're going to die. They have this disease, and they now have the tools to be able to deal with it.
The difference between this one, and I've been to a few other small town halls and some of the big conferences, is it just seems like it's more patient-driven.
Family members maybe try to understand, but it helps to have someone who has cystinosis that knows what you're going through when you're growing up and how you can vent to them, whereas your parents or sisters or brothers, they might not understand and see it as a weakness. You would see it as a strength, that you just need someone to help you through that hard time. We all go through similar situations, but we all have our success stories. We all have our fight story. One of them being that another mom is here. There's not many mothers in our community, and she has 2 children, and I think that's just awesome. It is inspiring.
Some of these patients that came this weekend, I've never met before. Even though they've been to the conferences, we've all been there, but there's so many people that you don't have time to sit there and be like, oh, what's your name? Every time somebody else learns something new and shares it, it's getting our voices heard. We're becoming something more than just a person with a rare disease. We're becoming that family that's going to be great.
It kind of gives you a boost of self-confidence. It kind of makes you think about things also. And it just opens your mind just that much more to, hey, I really need to get a hold of this. I need to do what I can. And if there's something I want to do, I can do it.
I think if you're an adult who is interested in getting more involved, this is a great place to start.
Issues applying in Ecuador. Early initiation of treatment with histamine may prevent kidney damage and prevent transplant, radically change the prognosis of the disease and improve the physical growth during infants. Also, permanent therapy may not prevent renal complications of cystinosis.
Cystinosis is a disease that affects every cell in the body. And what happens is our cells use amino acids. One of them is called cystine. And after your cell's done using cystine, normally it's transported out and kind of like waste at that time. It just goes out of your system. In people with cystinosis, it can't get out. It doesn't have a way to get out of the cell. So what happens is that it sits there, crystallizes, and builds up and essentially kills the cells off. So every organ's affected.
Gabby has told me, like, I have sand in my eyes. And so photophobia is another symptom of cystinosis. But that's hard. It's hard to hear that she thinks she has sand in her eyes, but I know that it's really versus forming in her eyes.
terminal disease that is kind of eating away at you from the inside out. Kidneys are the first ones affected, and then it just continues on.
I think it's hard that we have to wake her up or interrupt her day to give her medication to keep her alive. I'm also concerned about the muscle wasting issues. I just want her to have the best life possible and to be surrounded by people who love her despite what she has to deal with. I just want the very best for her, and I just don't want her to have to slow down or stop doing anything she would want to do because of cystinosis.
If you focus on your child's personality and how they're being, and just focus on the good part all the time, try and stay focused on the good part, because the one good thing is that, when Gabby's running around, she is happy. She's always happy. She's content. And, we don't have to look at the disease every day. You can choose to do that, I think, but you as a parent don't have to.
The disease community is small, but it's supportive, and we have foundations like the Cystinosis Research Foundation that are working so hard every day, and doctors and researchers are in their labs every day fighting for our kids and giving us hope.
I mean, the stem cell stuff that Dr. Shirk is doing is awesome, groundbreaking work that is going to have effects on more than just cystinosis, right? It's actually going to affect every disease to a certain extent because she's figured out an innovative way to fix what's broken. And I mean, that impacts tons of diseases.
Don't fear, there's going to be a cure, and we're just going to keep doing what we're doing and fundraising and just keeping our chin up and looking to the future and knowing that it's going to be bright and there's hope for our kids and for our families.
Conclusion is cystinosis is a lysosomal storage disease characterized by the abnormal accumulation of the amino acid cystine. It is a genetic disorder that typically follows an autosomal recessive inherent parent.
I'm Katie. We work in Canada. My hope for Abby is to live a full life, a happy life. We do wish for a cure, of course. We have to bring a lot of stuff with us when we travel. A lot of medications, a lot of things to just make her feel comfortable. While we were here, Abby was sick yesterday actually, so we had to go to the walk-in clinic, so that's an extra challenge, explaining to them what cystinosis is. It's super, super encouraging just to see where they're at and even to meet some of the older patients with cystinosis and see what they're doing. It's very encouraging. Abby today was just excited to play with her friends again that do the same things as her and take the same medications because she doesn't have that at home. So yeah, it's really uplifting being here.
Thanks.